Catching up now. Our next speaker will be Jorge Juan Fernandez, Director of eHealth at Barcelona Children's Hospital and Director of MOEBIO D-Health Barcelona. MOEBIO is a disruptive talent development initiative in which life sciences, health, business, and technology meet in a way that accelerates entrepreneurship in healthcare. Oh, there you are.
Hi. The idea is that I'd like to talk today about collaboration innovative collaboration in healthcare and life sciences. And I'm going to be giving you a brief overview of lots of things briefly. The most important thing is that if we take a look at a knowledge economy, the two most important activities that happen there, research and innovation, they are both of them extremely inefficient. Okay, there are gaps between institutions, and we really need to fill these gaps. The whole idea is that when you take a look at the history of business, we have all the rules, principles, and tools for how to compete, right? But when you take a look at how to collaborate, there are missing gaps. So what is collaborative innovation? It's a different type of innovation that is characterized by three things. Number one is that it builds unique partnerships, fostering innovation through collaboration rather than competition, number one. Number two, it involves many agents, and traditionally not just the traditional bilateral agreements, and that involves people that are usually separated. And these are the six usual suspects that are separated. And the third characteristic, and this is very important, is that these people, when they collaborate, they're more concerned about creating value than they are about capturing value. Okay, this is very important. So let's start with some of the examples. Let's start with the challenges and the competitions. The two most important ones are Kaggle in San Francisco and Innocentive in Massachusetts. They are both platforms, data analytic platforms for running competitions. As you can see, Kaggle has more than 450,000 data scientists involved, and up to now 202 competitions have been completed. And then Innocentive started earlier, and then you can see that more than 2,000 open challenges have been held. You heard yesterday from Adrian Carter, the success stories of Innocentive and Boehringer Ingelheim. Then we can do that to the country level. The most famous one would be the Longitude Prize in the UK, and the goal is to solve the problem of global antibiotic resistance. Okay, what is the prize? The prize here is £10 million for the winning team. They are up and running, and final results will be in 2019. But you can also do that at the university level. You can have here Harvard Business School recently launched the Precision Trials Challenge to try to improve to try to reinvent the clinical trial processes. They got 157 ideas. 10 ideas were evaluated, and one winner was recently announced. The winner was Max Miner from the Dana-Farber Cancer Institute. Okay. But you can also run competitions and challenges not to solve problems, but also to create problems, to create research hypotheses that can help spur innovation. This is the best case that I have. This happened also in Harvard. Harvard Medical School in 2010 sent an email invitation to faculty, staff, and students in the community to try to come up with research topics in the field of type 1 diabetes. Okay? 250,000 people submitted ideas, and it resulted in 150 research ideas and hypotheses tested. 12 of them were selected as winners, and then as of today, 7 of them are already working on potential breakthroughs. So the idea is that you can use competitions to generate problems, not just to solve problems. But I'd like to move not from collaborative competitions, but to innovative collaborations, okay? And this is the type of things that are happening in healthcare these days. People that before never get together, they start getting together. At the hospital levels, hospitals are getting together. We have here 2 initiatives. One is High Value Healthcare Collaborative, where people get together basically to share best practices and to ensure that they adopt best practices. On the other hand, we have H.Sant, has been already mentioned. The most important message here is that they work together to get new outcome measures, new data sets, so they can be implemented in hospitals to change the way healthcare is delivered. One of the most interesting cases at the hospital level is the solutions for patient safety. This is a group of more than 100 children's hospitals in the US that they decided to share the data on safety, basically the number of people that they killed, the number of children that they killed, okay? So they decided not to compete on those numbers, but to collaborate to learn from them, to save kids sharing these data. We can also move into research institutions. We have here the CEO of Barcelona Institute of Science and Technology. It is a merge of 6 research institutions, not all of them related to healthcare. So this is not the case of a fusion, of a merge, but it is the case of not getting together to reach scale, to get bigger numbers to appear on top of the lists when we talk about scientific publications. It is about changing the scope. It is about learning and creating the scientists that the world demands, which are more interdisciplinary and not monodisciplinary. We have also companies collaborating together. This is the Health Transformation Alliance in the US. This is 20 companies who are responsible for healthcare benefits for 4 million people in the US that account for more than $14 billion annually spent on healthcare. And companies such as American Express, Coca-Cola, or IBM are involved here. The idea here is that they get together to share expertise and reduce the cost of healthcare for themselves. And we have regions, you know, the Massachusetts Life Sciences Center. We have a great example here. The most interesting thing here is how you get together to increase the collaboration from the public sector. This is from the private sector. This is a 10-year initiative with $1 billion involved. And we have countries with the EIT Health getting together with 6 co-location centers around the world. So this is a totally new initiative. People getting together to share and to increase instead of to compete. If we think about pharmaceutical companies, the most interesting case is the Center for Therapeutic Innovation by Pfizer. This is making available the small molecular antibody libraries from Pfizer for universities to learn. But this is more, you know, these are the type of things that are happening where 3 global pharmaceutical companies get together with 3 world-leading universities. They form Apollo Therapeutics. There is a fund involved, and there's lots of things. This is really tough. It's not just one company putting out things, but it's 3 companies and 3 universities getting together to do new things. You can also do things not related to money, but related to data, you know, data and how can you share data. This is the Project Data Sphere, and it is about getting people to share data for cancer research, you know, so everyone can share and everyone can gain from this thing. And then we can get to universities. You get Stanford BioX. This is an initiative for getting together more than 700 scholars from the fields of medicine, basic sciences, and engineering, up and running from 1998, a very successful case. We get Spark, you know, the next speaker will be talking about that. You know, in this case, we're talking about collaboration, not within the university, but from the university and also the industry. It's about accelerating the translation of university-based discoveries. We also get BioMedX, recently presented by Christian. Indeed, you know, that's the only one outside Stanford that I found that is really, really interesting. Congratulations, great job. What I really like about it is the idea of bringing people into the first physical location together. That's a great insight. And then we get another one from Stanford Biodesign, which is getting people from these different disciplines to get together. So it's industry, it's universities, and it's hospitals, right? We have 4 initiatives here in Europe. One is the one happening in Barcelona called MOEBIO, the one that I ran. Okay, so this is very scalable as the one, probably the first one wasn't. So to end, what are the 3 policy prescriptions for people? So the best important message that I want you to get through is that companies need to choose wisely where and when to compete and where and when to collaborate. This is going to be the toughest, difficult decisions in the future. So governments, what is the role of governments? The role of governments has really changed. In the past, it was about spending a good portion of the money in their right priorities. For us, healthcare and life sciences is very important for creating a knowledge economy. But now the real role of governments is to involve the private sector with matching funds. This is really incredible what the people at Life Sciences Massachusetts have done. Also, the ability to align the different government actors. Keep in mind that in the US you have 3, but here in Europe we have the local, the regional, the national, and then the supranational, the European Union level. So you need to be able to align all those actors to provide the right incentives. And also the third new thing for governments is to change the healthcare payment system so the incentives are the right ones. For companies, everything starts with talking to the right people at the right time. And with love affairs, we all know that finding the perfect person at the wrong time is terrific. Terrible. And we want that to be terrific. For some people, it might be terrific, okay? But I think it is terrible. So it is very important that companies, you choose, no matter whether you're startups or large established companies, you choose your large-scale problem, the one that you want to tackle. Is it safety? Is it cancer? What it is, right? And for individuals, we're talking about developing new skills. Basically, this is a must for physicians and researchers for the future. We need to bring people with new skills and also engage and create a network of people with different backgrounds from yours. And with all that, thank you very much for your attention.